Good afternoon, everyone. This is the January 12th, 2024 regular monthly meeting of the 2019 House Bill 737 Study Commission of the Environmental and Health Impacts of Poly and Perfluorinated Chemicals. The first order of business for us is to take up the minutes of the December 8th, 2023 meeting, which Lorraine Allen kindly prepared for us. Did anyone have questions, comments, revisions? Okay, seeing none, I'll call for a vote. If somebody would like to make that motion.
I'll move that we accept. Okay, I'll second.
Okay, motion by Don Preventure, second by Rosemary. If all in favor, please signify by raising your hand. Thank you, Nancy, for reappearing. And Senator Ricciardi abstains, as does Andy Fuller, who's here for Mike Wimsatt. So that would be 0-2. All right. Welcome, Andy, to another of our meetings. Thank you for filling in for Mike. Please proceed with your update from DES.
Okay, happy to. Hello, everybody. Excuse me. From the DES standpoint, I'll start off with air resources. Very little to report from the air resources standpoint at the site. As reported previously, the annual stack test took place in September 2023. DES members were present to observe that testing. All indications were that the equipment and the testing as planned in the pre-test protocol. So a final report was submitted to DES in November, and that report is currently under review. As far as the facility closure, as you're aware, in August 2023, we were notified about Saint-Gobain's plans to close the Merrimack facility. Saint-Gobain has fulfilled existing orders at the facility, which is anticipated to take until approximately April of this year. They've indicated they're going to continue to work with DES on the ongoing environmental investigations and remediation effort. That includes providing bottled water and permanent alternate water as appropriate within the consent decree area. Their current plans are to remove all materials, waste, and processing equipment from the facility. They have hired Ramball, a global architecture and engineering firm, to assist with those closure activities, and that's likely going to occur between the cessation of plant operations this spring and the end of the calendar year of 2024. We are anticipating receiving a letter report documenting those planned closure activities and associated schedule sometime probably in February of this year. And then we will obviously remain in frequent contact with Saint-Gobain during the shutdown process to ensure the property does not end up posing an additional risk to human health and the environment following its closure. From the waste management update, Saint-Gobain's contractors started the POET installation process for residents a little over a year ago. It was November 2022. At this time, all homeowners that were identified for a point-of-entry treatment system have been notified of their eligibility to start that process. This includes properties listed under the later term sheet attachments, which include numbers 11 through 17. As of as of the end of December, there have been approximately 540 POET systems installed. And they've been able to install nearly all POET systems for properties where the property owners were responsive to the initial contractor notification letters. In December, Saint-Gobain's contractor actually sent out second notices to property owners that are eligible, that did not respond to the initial contractor notifications. As described in the work plan for the installation, they're responsible for confirming the testing of the system effluent to ensure they're operating effectively. Because of this, we have approximately 508 of those point-of-entry treatment systems that are considered officially complete. The remaining number is based on just lag and the lab work and notifying the residents of that. They have also, their contracts with periodic maintenance of point-of-entry treatment systems in accordance with the work plan that was approved. Those results so far have shown that the systems are operating effectively. We anticipate receiving a report in the first quarter of 2024 that summarizes the results of last year's activities and that system installation effort and associated monitoring. So, in a second, let me see. I think I'm notified that my microphone is not sounding right.
Anybody wasn't, Amy was helping me
That's
out.
better.
Okay, good. So in July of last year, St. Cobain rolled out their point of entry treatment, their rebate program for eligible owners that they determine the eligibility of. They received approximately 30 reimbursement requests, maybe a few more than that, which were reviewed for eligibility and reimbursement this past fall. They've indicated us that they're working to notify those residents of how to be reimbursed this month in January. They are proceeding with the design and construction work for water line installations in the towns of Litchfield, Bedford, and Merrimack. This includes areas where there are existing water lines where homes require connections to the mains in the street, and areas where new water mains are going to be installed. There was a notice to proceed for construction was granted in October by St. Cobain for the Hillcrest Road area extension in Litchfield. Water main and curb stop installations have been completed along Rocky Hill Road, Shirley Way, Muscovy Drive, and Hillcrest Road, north and west of Meadowbrook Lane. Water main construction east of Meadowbrook Lane is expected to continue in January 24, weather permitting. So far, the weather's been working with them, so they've been able to continue the water main construction. The utility currently plans to begin home inspections to support the connections, the service connections in late January. The connections continuing throughout the winter, obviously weather permitting, and they're estimating this project over there to take approximately 6 months to complete. They have also been working with the utility company to proceed with service connections to existing water lines in Bedford and Londonderry. Those bids have been received for this work. Water utility selected a contractor, and St. Cobain's working to finalize contract documents. Design packages have been finalized for extensions and connections to existing water mains for the Merrimack area, including Wildcat Falls, Brenda Lane, and those service connections. The bid process was closed in December. St. Cobain and their consultant are reviewing those bids to make a contractor selection. It's likely that work's going to be conducted early this year. That's what they're telling us. And both projects are anticipated to take about 3 to 4 months to be completed. Should be, and hopefully that'll be by the summer of 2024. St. Cobain continues to work with the water utility and the town of Londonderry to evaluate the feasibility of water line extensions in that town. There was a conceptual design that was completed on behalf of St. Cobain at the end of April last year. And since that time, St. Cobain has met with the town of Londonderry and DES and other stakeholders to discuss the expanded water service for that area. Understanding is that Londonderry has applied for some supplemental funding to assist in the long-term expansion of municipal water in the town, and they're trying to see how all the pieces kind of work together to come to an agreement there. On the residential well sampling front, St. Cobain submitted Addendum 18 to the work plan for residential well sampling. That was actually submitted earlier this week on the 8th. We reviewed and have issued an approval of that proposed sampling that was outlined in the addendum. And they are also continuing to work on the retesting of wells within the consent decree area. As of the end of December, the second set of samples has been collected from over 1,100 properties, and that represents about 95% of the targeted properties. So there's been 2 samples collected from about 95% of the wells that they've sampled. Lab results from those second samples have exhibited that primarily from the wells that exhibited concentrations below 10 have indicated that between 5 and 10% of those resampled properties exhibited an exceedance during that second round. So that's the numbers that we're looking at for there. Each of those properties have received bottled water eligibility letters if they've been notified. With regards to previously unsampled wells within the consent decree area, DES has consistently expressed the need for additional sampling to complete all those wells. We've expressed that in a letter and in multiple conversations with them. We in fact actually, Addendum 18, we had required that they include them all. They have continued to stand by their previous methodology and not deviate from only proposing sampling within a 500-foot radius of an HQS violation. So that recently submitted addendum 18 only included really a small number of properties consistent with that methodology. So DES is going to be proceeding with completing the sampling of all of the remaining homes within the outer boundary of the consent decree area. We anticipate that effort to take about 3 to 4 months. And we've also made it clear to Saint-Gobain that we intend to cost recover for the allocation of resources to complete that work. On the site investigation front, as you're probably aware, the remedial action plan was submitted to DES back in May. We have met with Saint-Gobain, their consultant, in June, and we also met with them again in December to discuss the contents of the remedial action plan. They are planning on submitting a remedial action plan addendum, and we are expecting to get that before the end of January. And at that time, we'll review and issue our comments to them. And that is all I have from my update. So I don't know if there's any questions.
Questions for Andy? Rosemary?
Yeah, thank you. Andy, thank you very much for your update. Can you just tell me again the number of homes that were resampled and found to be over the MCLs? You just mentioned it a little bit ago.
So I don't have the exact number. There's 1,127 homes as of the end of December that had been sampled, and I'll provide this in the detailed notes
Okay.
when we fire it over. But it's about 5 to 10% of those, so it's on the order of less than 50, I think, is where it was.
Okay, and then one more question. Has Saint-Gobain submitted a plan, or is DS going to be asking them for a post-closure plan, site plan, if they plan to transfer, I think, operations to someone else? Have they gone into any specifics about the post-closure use of that property?
No, there haven't necessarily. They're going to be submitting kind of a letter report to us that kind of documents what their plan is for the facility itself and how they plan to decommission the building and go from there. But nothing beyond that, I guess.
When do you expect that letter and plan to come to DES?
We're hoping for February.
Oh, okay.
You know, this is something they're moving. I think they're moving faster and going through their orders than they had initially anticipated. So I think they'll be wrapping up here, like I said, by April timeframe on their orders. So.
Would you do me a favor, Andy, and in your February report, just give a status on that if they've submitted it or not?
Yep.
Thank you very much.
Other questions for Andy? Don?
Yeah, thanks, Chris. Thanks for your summary, Andy. One thing occurred to me a couple of weeks ago. A friend of mine that lives in Merrimack off of Spalding Drive, he had indicated to me that his private well tested above the standard for PFOA, and I asked him how he became aware of that. He said that across the street from him, one of that neighbor received a letter in the mail saying that another well had tested above the standard. So I guess it's that 500-foot distance, that radial distance, that the notification process. So I started thinking about it, and I thought to myself, I'm like, if my friend had decided not to test his well, so would that be like, sort of like a daisy chain of notifications? And being a chain, if that one link doesn't participate, does that stop the chain there as far as the next abutter on the other side of him not getting notified? Seems to be like there could be something missing there if that was the case. I don't know if that is the case. I don't know if you can explain that better to me.
I can try. So I think there's two avenues kind of in effect here. One is Saint-Gobain's procedure for sampling, which they sample all wells within 500 feet of an exceedance. So they would be testing those wells. DES also has our notification program where we notify everyone within the 500 feet that there's been a groundwater exceedance. That's not a sample request letter, so they're slightly different. I believe at this time, everyone within the consent decree outer boundary should have received one of those groundwater notification letters from DES that,
Yeah.
is part of that.
This is outside of the outer boundary, this property
Okay.
that I'm talking about. So that, I
Then
don't know if that makes a distinction.
It could from the daisy chain effect that you're talking about. Like if you
Yeah.
don't fall within that, then you may not get that notification of if you're not within the 500 feet, I guess.
Yeah, and luckily, you know, my friend decided to go ahead and test as well, and he actually did receive the $10,000 rebate to connect to MBD's system. But it just made me think that if he, you know, and there are people out there for some reason, even though it's free, if they refuse to test, which some people might do that, then any well 500 feet from them would not be noticed as well. So I just don't know if I don't know if there's a way to overcome that or not. You know, I can't really think of a way, but it's unfortunate that that chain could be broken by one person who, for whatever crazy reason, doesn't want to test their well. Maybe they're selling their house. They don't want to know that their well is contaminated or something, you know? So there's a real concern there, I think. I don't know what the solution is, but I'm just trying to identify that for consideration.
Sure.
And,
Yeah, I
you
mean,
know,
there's a lot of people that still have not tested. You know, we still get new
yeah,
sample requests every day. We send out those notification letters, and like you indicated, it's a free service offered by the MTB Remediation Bureau, and people may still not even take. They still don't take up the offer for the sample too. So
right. And then the only other two questions I had, just I didn't know if you have any update, and I don't know if you're involved with the soil standards for PFAS, if you know where that stands now. I know there was a public comment period and a lot of people submitted public comments, but I don't know what followed from that or what the schedule is to follow from the soil standards.
yeah, I'm not involved in the development of the
Okay,
soil standards now, so I wouldn't feel right kind of speaking on it, I guess, at this time.
right.
So.
And then just the last one is the St. Cobain remedial action measure that I know they were supposed to submit a follow-up modification to that initial plan at the request of DES. Has that been submitted yet at all, or is that still forthcoming?
No, that's something we're expecting before the end of the month. They've indicated they're submitting it in
Okay,
January 2024. So we should have it. That's not to say that they won't delay, and then it'll be the
right.
kind of the update next month will be that we're expecting it by the end of the month. But they have indicated it's coming. We met with them in December on it, so I think it's pretty close to their finalization from that standpoint. So we should see something soon.
All right, great. Thanks. That was all I had.
Anybody else? Just a couple for me, Andy. In that area where St. Gobain has declined, in the consent decree area where they've declined to do testing, and DES is going to do it and see cost recovery, do you know how many roughly properties are involved or order of magnitude?
We've had our team do some GIS kind of mapping, and we estimate that number of homes to be on the order of about 250. You know, the recent sampling addendum included about 24 properties, so it's going to be somewhere in that 2 to 250. We think that of properties that we're going to sample. A lot of them are located kind of in the northern area, Bedford, near the fire station. These are in areas where St. Cobain has claimed there's other potential sources, and another area of homes is in the kind of that western lobe of Bedford too, north of Merrimack.
Landfill, yeah.
Yep, that area
Any,
too, and then I think there's a few in like the Hudson area. So.
sort of on that point generally, I just want to thank Andy for dealing with a request of mine, which was to let our town of Bedford import state sampling results from the state's GIS map. And Andy has said it's easy at his end. And, hopefully at some point our town GIS manager will be speaking with you, but it will make life a lot easier at the town level, and especially, not just in Bedford, but in the other affected towns, to be able to have a box you can click on in the GIS system to see where all those dots are. And, Don's friend wouldn't see somebody necessarily within 500 feet, but possibly within 1,000 feet, and could act on that. And, I have a concern in our planning department process for approving subdivisions where we see people combining 2 lots to make 3 or 4 to make 5. If that happens, there's an unsuspecting buyer of a lot, and that could be in the consent decree area. It might be outside of the consent decree area. So being able to just click on a box and see where all those dots are in our towns would be hugely helpful. Certainly to me, I zoom in on Bedford and then try to identify roads from, where schools are and things like that that are recognizable. But that's a real help, and I appreciate your willingness to do that.
Yep. Yeah, all that information indicates available online on the PFAS mapper. And I did actually speak with Rick Sawyer from the town manager and the GIS earlier this week, and I sent that information off to them. So I think they're in the process of working on that, Chris.
Fantastic. And the other thing to say, which you pointed out, is that the state information is live. It changes as that data changes. What would be in a town system would be what was there at the time it was imported. So like many other things, the towns would have to update that periodically, but still a huge help. And thank you for doing that. Okay, Leanne, can you give us your update from DHHS?
Right. Good afternoon, everyone. Have some good news to share about the contract with the academic partner for the phase 3 feasibility study for the Merrimack cancer investigation. That contract was approved at the December 20th Governor and Council meeting. The contract is with Dartmouth College. Dartmouth College is well positioned to complete the study. They've operated and maintained the New Hampshire State Cancer Registry since 1985, and they have well-established and well-developed cancer data reporting and analysis capabilities. In addition, they're also the only National Cancer Institute designated comprehensive cancer center in New Hampshire, and so they've got, good resources to help with the study, including access to the academic researchers. The contract is expected to be completed by June 30th, 2025, but there is a 2-year extension that's available in the event that the additional time is needed to complete the study. The study is going to be based on New Hampshire's Cancer Concern Investigation Protocol, which includes convening a community advisory board and a scientific advisory board. And the team is looking for recommendations on members to serve on either board. So just a little bit about those boards. The Community Advisory Board will represent the needs of the current and/or previous residents of the study area of interest and provide input into the feasibility study design, completion, and communication plan to the general public. The Scientific Advisory Board will provide expert input for the feasibility study design and completion. So as I said, we are looking for recommendations for members to serve on either of those boards. There's also a steering committee that includes staff from Department of Health and Human Services and Dartmouth, and it'll provide more general project oversight to make sure that the work plan timelines and deliverables and milestones are met. And there's a core team of staff that have been meeting weekly to initiate the project. So we're very excited to have this underway. And that's my update if anybody has any questions. Thank you.
Leanne, how big are those advisory boards?
I think we're still trying to decide that. They want them to be large enough that there's good representation, but not so large that they're, not able to work effectively. So I think, we're thinking 10 to 15-ish members, but that's still, still being worked out right now.
Nancy, and then Gary.
Thank you, Chris. Leanne, I'd like to volunteer for that
Okay.
Community Advisory Board.
Okay.
Thank you for that. And we'll certainly spread the word around, people that we know might be, appropriate volunteers for that. So thank you.
Okay, great. And we're working right now on getting some kind of communication materials together to send out to invite people or to share more information that people are interested. So that's great to know that you're interested. I'll pass that along. And definitely, if there's others that that would like to be involved, let us know.
That's great. And because I know I'm getting, I think with just the publicity and social media and on some local media, I'm getting phone calls at home from community members, who had experienced the kidney cancer and have had fatalities. So that would be great. Thank you.
Okay, thank you.
For the communities, Leanne, are you looking for the 4 that are identified in the statute, or a broader area to include Hudson?
That's a good question. I think at this point, you know, the study area is still being defined. So I'm not sure that we have a geographic bound on that just yet. But so I'm not quite sure of the community, certainly the, you know, the main communities, but that's a good question about whether or not it would extend further out than that. I think we're still trying to determine that at this point.
Gary, were you
Leanne?
volunteering?
Oh. I was just going to volunteer Laureen Allen. I'm sure she would appreciate being on that committee as well.
Yes, and I think that Dr. Megan Romano, who is the, you know, a main contact at Dartmouth College, if she hasn't reached out to Lorraine, was going to, so certainly keep her in the loop as well. Yeah.
Gary? You're
Oh,
muted, I think. Can't hear you.
Okay, look, it had green, but
There you go.
try again.
Perfect.
I was using the space bar and it showed green, but I guess they weren't coordinated. Anyway, on the advisory board, is that in state, or are you looking for people that can contribute from a national basis as well?
For the scientific advisory board,
yeah.
I think there's been some discussions about looking further afield than just in state for.
I would hope we could, because there's a lot of work has been done nationally that would really make this job easier from a scientific perspective instead of trying to reinvent the wheel.
Yep. So if you have any specific recommendations, please share those. Thank you.
Any other questions or comments for Leanne? All right. Maureen Mooney is not here. I know she usually has a commitment partway through this meeting anyway. So I'll just open the floor for updates on legislation. You know that there was a 1649 committee hearing. I don't know. Nancy, you were there?
I was, along with Representative Rung. And let me just, actually, I just gave out a sort of Reader's Digest report last night to the town council. So I could address that. 1649 was Representative Ebel's bill. And let me just grab my, sorry, just flying in here in a wing and a prayer. It was relative to regulating, it was in the Commerce Committee, and it was relative to regulating, prohibiting certain products with intentionally added PFAS. And I know I didn't ask to put it on the agenda, but I was wondering if this is a bill that if people reviewed, the commission could submit a letter of support for, especially given, you know, this area, these 4 communities have been so highly impacted by PFAS that the last thing we need is more. And if we have the opportunity to stop a source, this is certainly a first step. And Representative Ebel gave a great testimony as to why it's necessary. DES didn't take a position, but provided some really phenomenal testimony as well. And you know, we know the health impacts. We know that, you know, these chemicals so compound themselves, bioaccumulate in our body, and the best thing we can do, especially in an already compromised area, is to not further contribute to that bioaccumulation. So I would just ask everybody to take a look at HB 1649. It was heard yesterday, but I don't think it's too late to reach out to the committee members. I actually leaned over to Representative Rung during the hearing, and everybody, with 2 exceptions, was there in support, which is very different than the experience we had just 7 years ago. And I remarked, I said, it's so nice to see that everybody is paying attention and people are getting on board. Conservation Law Foundation attended, and they had a list of supporters that Sierra Club, and they went down the list, and it was quite extensive of supporters that submitted a letter as a group. There were only two people signed in opposition, and one was the lobbyist for American Chemistry Council, and the other was a gentleman, and I don't maybe Representative Rung can remember his name. He said he's been working on the PFAS issue for a long time. None of us recognized him or heard of him, so I'm not quite sure who he was, but there was a very disproportionate opposition support group, and that was really nice to see that this bill has such great support. So it's a first step, but it's a really important step, and it would be, at least in my opinion, very helpful to the communities that are impacted by the issue that we're addressing here. So that was 1649. The other bills that I would ask people to pay attention to would be, it was one of my bills actually the other day. It was HB 1393. It was a pediatric cancer bill, and it was held in Health and Human Services. And I think I think there was 82 people in support and one person neutral, and that was the Department of Health and Human Services. And they came in and provided great testimony as well. And it's essentially, that was just to, it came at the request of a constituent whose son was diagnosed with childhood cancer when he was young. He's now 14. And they both came and delivered testimony. It's Amy Mendez and her son Max, who lived here in Merrimack and wound up having to move to Nashua when they lost their house and everything, given Max's long treatment and everything else. But they provide some pretty compelling testimony as to why childhood cancer needs to be included in our state health improvement plan as a priority. I think there was probably really good support for that. The challenge may be that a concern exists that by mentioning that specifically, by naming a particular illness or diagnosis, it could open up a floodgate of other health impacts that, bills could be coming to Health and Human Services to say, well, please add PFAS, please add whatever. And so I'm not sure what's going to happen with that, but it's certainly a worthy bill, in my opinion. HB 1707 is a blood testing bill, and I'm trying to see if I have it. I don't have a date. It's going to judiciary, and it's coming up, I think, on the January 24th at 11:15 a.m. And that we noticed a number of years ago the challenges with access to blood testing, and Senator Chanley wrote a bill, and a number of us co-sponsored, that may require New Hampshire insurances to cover PFAS blood testing, which was wonderful. It passed, and it's in place now. The challenge with that is it excludes anybody on federal programs like Medicare and Medicaid. So if you're a disabled person or a senior citizen and you're on Medicare, or a low-income person that may need the support of Medicaid, you're not eligible for that. Also excluded are people like my family. My husband's health insurance came out of Pennsylvania, so that families like mine would be excluded. So anyway, this is a bill that would open up that testing to everybody. It's not, again, exactly as I would have liked. It would require people to pay for it first and be reimbursed by identified polluters with strict liability. So it's not as if the person, like me, I would have to prove that whatever, Saint-Gobain or TCI or any industry was the one that with the predominance of exposure. And so if a polluter had been identified as having polluted the community, they could be held responsible. I don't know where that will go or what will happen with it. The other bill that, I would ask people to keep an eye out for, and please sign in and support, is, let me see here, is a bill that actually is relative to some of the things that were mentioned earlier by Andy, and it's House Bill 1415, and it's a PFAS facility liability bill. And a number of the, this bill has come from a number of the discussions we've had over time, and concerns regarding, what is going to be in place for, industrial polluters like Saint-Gobain when they shut down. What happens to the community? What kind of exposure do we have? And how will polluters be held accountable? And it actually takes into, I think, what best way to put it? It holds polluters accountable to the federal regulations for closure, removal from service, and decommissioning. So we don't have a date on that one yet, but that will be coming up. Two other bills that I would ask for support for too are, I submitted a bill to reestablish the environmentally triggered chronic illness commission as HB 1171, and that's next week. Let me see if I have the date. I think it's the 18th. Yes, HB 1171 is in Health and Human Services on January 18th at 2:45. So I asked for support for that, especially this is important to look at. And we look at a number of things, not just PFAS, but of course, given our kidney cancer concerns and everything in this area, this commission is certainly involved with keeping an eye on that. The other one would be HB 1114. That's the bill I submitted to reestablish this commission. I don't have a date on that one yet, but again, that's going to go to resources, and I would ask that everybody, individually and as a group, if we could submit a letter of support for the need to continue this. It's a 5-year. All I'm doing is, the bill basically just extends the end date. So it's a simple bill, but I think it would be important to make our case as to why it's so important that we continue this work. And I can't imagine objections to it. There's a lot of support in the House and the Senate, but I think if we could answer, okay, you've been involved with this for 5 years and Saint-Gobain is leaving, why do you need to continue to do this? And I think we all know why, but if we could maybe put something together from the commission, that we still have a lot of work to do, that would be really helpful. And I can't think of any more right now, but hope that's helpful. Thank you.
Hey, Nancy, quick question. Just in reference to what you just mentioned, it seems like there isn't a lot of opposition to reestablishing the commission. I would hope, but you think there'd be value in addition to any testimony from commission members or the public to write? I don't know if Chris already has that in the works, or there's a plan to write a letter, saying that you guys do want this to continue, or potentially even listing future goals that still need to get accomplished.
I think that'd be really helpful. I think we know what we're doing, and I think we are the best advocates for what we're doing. We'll make sure that we get this out to communities as well. But people are much more informed, much more educated about this issue, and now recognize the value. But I just want to make sure there's no question as well. It's been in place for 5 years. Sometimes people don't understand the work that's involved and how challenging things are sometimes to get done, and how the more information we get, it changes the course of things and the direction and the questions we ask. So I think the making clear that we have this need, there's still a lot of work to be done. We need this other 5 years, and that any support that we can get from ourselves, from the commission, but also from our communities. I think this and the other commission are really important for us to rally around. So I absolutely agree, Mike. Yep.
That's, I defer to, I don't see Lori on here, in charge of communications, but or Chris even, and Senator Ricciardi, obviously you've done a ton on this also. So maybe listing, the accomplishments, what has happened at the state level and locally, as a result of this commission to kind of say, hey, this is, these are the results that you have, and these are the future goals that we want to try to accomplish.
Denise, please.
I just want to say I really don't anticipate any problem with this. I've already spoken at length with Senator Bradley. It's great to just solidify and ensure everything. I think the letters and testimony and support from us is good, but I'm not seeing that it's going to be any sort of a struggle.
It's good to know. Thanks, Senator.
Gary.
Yeah, I from what I hear, and I'm not in the House at the moment, but I don't see any difficulty and adverse comments. I mean, I think it's very important to continue because this organization, this commission, brings together all the divergent parts that are looking at a scientific basis, the implication and the implementation of that transition to Saint-Gobain leaving, and also the implementation of intervention. So it brings all the divergent parts together, both for the benefit of the state in terms of what's being accomplished, but also the public to have an understanding. And I think it's to do away with this commission would be a real disservice to all involved.
Nancy.
I think I'm not as worried about the commission not continuing, but I'm concerned a little bit because there's a new House committee on commissions, and the rules around the commissions have changed, which is why I filed the bill the way I did. There are some things I would have probably changed and added, but I chose not to because I didn't want to open up discussion on that. There are limits now on House commissions to the number of members. The maximum numbers is 15, and the majority of the members have to be legislators. And with all due respect to legislators, I don't see that we need 8 legislators and try to figure out how we're going to cover 4 towns, 4 town government, citizens from each of those communities. I don't see the value of the legislators as being higher than the value of all those other people. And my plan is to be very clear that this is simply a reestablishing the commission and being grandfathered in under the old rules, because my fear is that there could be yes, you can reestablish the commission, but you have to follow the new rules, which would mean cuts to members that I think would be devastating to the commission. So that's really my biggest worry. So that's why the bill essentially is just to extend the date for 5 years, and so we can hopefully avoid getting into having to follow new rules that in my mind, it's not a new bill. It's an extension it's just changing the date. So it's not a new commission. So I want to be grandfathered under the old commission rules and keep things as they are.
So last October, we passed a resolution. It's very compatible with supporting 1649. So I'm very comfortable based on that with the commission doing a letter. I'm not volunteering to do a first draft, but I will do the second and final draft if that's the desire of the commission, and if the commission wants to do a letter in support of 1649, I'll need a motion on that.
I'll move.
Okay. I see you. I don't necessarily hear you, but motion by Nancy and seconded by Gary. All those in favor, please raise your hand. Okay. Any opposed? And I note your abstention, Andy and Leanne. So that passes. And Nancy, were you going to do a first draft? I think we probably could take segments of these minutes and put them together, and that would be good support.
Sure.
Thank you. And I don't know, is there a feeling that it's a good use of our efforts to support the extension and do a letter? Again, I'll need a motion for that, and I'd ask for somebody to do the first draft. Motion by Nancy, second by Mike Strand. All those in favor, please raise your hands. And I note the Andy and Leanne's abstentions.
Excuse me, Chris, I'm happy to take on drafting, but I admittedly, because I am so new on this commission, I might need a hand with some of the science and some of the things that have been accomplished in the past, you know. I don't know if anybody would want to tag team that with me.
Well, I'll second draft and I'll final draft, but you can take a look at our annual reports. That's pretty comprehensive.
Okay.
Probably the last one is maybe the most. Okay. And Denise, you have a bill pending that's near and dear to me. So is that scheduled for anything?
It's not scheduled yet, and as soon as I find out, I'll make sure an email goes out to everyone.
Great.
I am getting a little pushback from the New Hampshire trial lawyers, and someone else yesterday didn't like some of the language, but I say we go forward. We had help from Mike, and so the language has been vetted very carefully. So I say we just go for it.
Yeah, it's interesting to get pushback from that quarter, because what I would expect is the typical sarcastic full employment for lawyers bill, which is anything but true. So I'm kind of surprised that that's where you're getting pushback. But anyway.
I was asked to pull the bill. But I said I'm not doing that.
Okay.
But I did let them know that you are on the committee in this, was largely to you and thanks to you. So they have your name, they can reach out.
Absolutely. Okay. Maureen, I thank you for your maintaining the spreadsheet and keeping it active. It's really helpful, certainly to me, in getting ready for this meeting, and we probably covered a lot of the ground before you were able to join us. So you probably don't even know if you have something to add, but I'll give you the last word on legislation.
Thank you, Mr. Chairman. I appreciate that. As you know, I run late because I've mentioned when we talked about moving this commission to 1, I have regularly a standing commitment at 1 on Fridays. So I look forward to a time when the commission will reinstate its meetings, perhaps to either a later time in the afternoon or in the morning. But be that as it may, I do have some things to add. Please stop me if in fact you covered them already. But I'd like to start with the 2023 PFAS legislation tracker. 4 bills now on that chart have had final action taken by the House when the House met earlier this month. So House Bill 398 is now ought to pass with amendment on a voice vote, and that's headed to the Senate. The other 3 of the 4 on the 2023 PFAS chart are either ITL or interim study by the House. So those are done essentially for this term. Those are House Bills 414, House Bill 242, and House Bill 465. Okay, I'd just like to move to the 2024 chart now. As you know, there are 11 bills that we're tracking that I was made aware of to put on the chart, and the chart has been updated as of Wednesday. This past week, 2 bills and 1 resolution that I want to talk about briefly. 2 bills had hearings this past week because the legislature is in full swing, And next week, there are hearings scheduled as well for some bills on the 2024 tracker. But I just want to bring to your attention, as I was updating the 2024 tracker and, connecting all of the bills to their texts and so forth, that there is a House resolution among one of the bills we're tracking this year. And that is HR, not HB, but HR 28, an act urging for the compensation for injuries from PFAS and for the closure and cleaning of sites affected by PFAS, sponsored by Representative Wendy Thomas and others. So just to highlight that, because a House resolution need only be, is my understanding, only be adopted by the House. It's not legislation. It's just really, much like we have resolutions in this commission, it's a resolution to be only adopted by the House and then go forward to those that it should be addressed to. Different from a concurrent resolution where both bodies would have to adopt it for it to go forward to the addressees mentioned in the resolution. This is just an HR, House resolution, House action only. So that's HR 28. That's my update. Thank you very much.
Okay, thank you, Maureen. The next item I put on are commission priorities. I know I have my own and I speak about them from time to time, one of which is to do some soil sampling where we might most expect to find PFAS contamination around the St. Gobain plant before we pronounce our work done. Certainly, and obviously advancing the legislation that we have wanted to get on the agendas at the legislature for so long is important. But just wondering from other members what you feel the priorities are, what we should have as goals for 2024. Both assuming, I guess, I don't want to assume that we're going to continue after this, but it looks like we will. But I also want to proceed as if this is the most important work that we do in 2024 to wrap things up. So if you want to think about that, please think about that. But as I look to put together agendas for the rest of the year, I would like to focus on the things that are important to you as well. Okay. So that said, our next meeting will be February 9th at 1 p.m. unless there's a change. And Maureen, I'll respect your request and we'll reach out to everybody to look at their calendars and see about the feasibility of starting at 2 instead of 1, if that works for everybody. So, Rosemary.
Oh, I wasn't able to hit the mute button fast enough, Chris, but as far as priorities, particularly if Nancy is named to that advisory committee for the cancer study, if we could add that onto our agenda, just so we can see the progress of what that study, so if she could be the point person to inform the commission.
Good idea. Nancy.
Sorry, Chris, I just wanted to add, I sit on criminal justice and public safety, and it seems that we're going to do a lot of hearings on Friday mornings. As a matter of fact, I was flying home today because I know next week we're scheduled till 6 p.m. on Friday, and I'm going to be probably missing the 85 commission. So mornings won't work for me, unfortunately. So if we change anything, I mean, a little later works, probably far better than earlier. Thank you.
All right. Any other questions or concerns before we adjourn? Don't see any indication of questions or comments from the public. So with that, at 2:01, I'll entertain a motion to adjourn.
So moved.
Motion by Representative Rung, second by Gary. All those in favor, raise your right hand, please. All right, that's unanimous. Thank you all, and we'll see you next time, if not
Thank you,
sooner.
Chris. Bye, everyone. Have a good weekend.
Thank
Hi,
you.
everybody.